Welcome to the Nurse 380-002 clinical group. We have two clinical sites that we share. Our first site is at Penn Internal Medicine at 3701 Market Street on the 6th and 7th floor. Both floors have a primary care office that serves adults. There's also a nurse access call line, a laboratory, and a Coumadin clinic. Our second site is at Penn Family Care at 3737 Market Street. The practice is on the 9th floor, and it provides for all patients' health-related needs from cradle to grave, including immunizations, an obstetrics clinic, and a procedure clinic for more complex needs.
Conducting the windshield survey, we noticed an economic boundary in real estate. There was a residential area and a commercial area. Market Street went from privatized big companies like health centers to more mom-and-pop shops and smaller businesses, which were in disrepair with dirty windows and old broken signs. The commercial area was manicured with flower boxes, large grass areas, and trees. The residential area was a neighborhood in transition, with old brick houses and houses under construction. The neighborhood had a garden and a park as the only open spaces that served as commons. All forms of transportation, cars, bikes, walking, and subways were in use. There were many healthcare service centers as well as a gas station and a Red Cross house. The area had many convenience stores, but no stores that had fresh produce. The area was very much alive with families, healthcare workers, and adult males walking and hanging out on the street.
We observed the people, places, and social systems available to the population that Penn IM serves. The people available at Penn IM and Family Care include a social worker and various healthcare professionals such as nursing staff, physicians, and allied health staff. One special program that Penn Family Care offers is an outreach program that trains community members to help patients adhere to their plan of care, such as taking meds and attending appointments. Community resources include dialysis centers, apartments for the elderly, child care centers, small rehab centers, the Red Cross House, and Action Aids. We gather data about the population that Penn IM and Penn Family Care serves. Most patients come from the Philadelphia area. The U.S. Census Bureau states that the Philadelphia population is 43.3% African American and 41.5% white, which is reflective of the Penn IM patient population. Most patients at the agency were over the age of 60. However, the U.S. Census Bureau states that 5.1% of the Philadelphia population is over the age of 60. An MA we interviewed at Penn IM also stated that diabetes and hypertension related to obesity are the biggest health-related concerns for the patient population. The Census Bureau data also cited that the prevalence of hypertension and diabetes was 37.5% and 16% of the population, respectively. From interviews with other staff members, there is a theme of knowledge deficit related to disease management and prevention.
There are several barriers to access and social determinants of health that define our population. Many patients have difficulty with accessing transportation and getting to appointments. The nurse manager states that many patients have poor health literacy and have trouble understanding and managing their conditions. There's also economic instability among our population affecting medication adherence and living situations. Furthermore, the surrounding environment area has high crime rates that prevent outdoor activities. According to agency staff, strengths include patient adherence to medical appointments, a new expanded facility, and patient satisfaction surveys that improve quality of care.
Our diagnosis is the risk of knowledge deficit among African Americans of lower socioeconomic status related to chronic disease management and prevention. Based on the assessment and the objective data collected, we learned that this community's primary health-related concern is education-related. We found it interesting that during the windshield assessment, many of the patients and the residents of the area were overweight. In the clinic, we learned that many of them have hypertension or are prescribed medications that they do not take as directed. We considered that this may be a problem related to cost or access. However, the medical assistant said that this was not necessarily the case. Instead, she said that it has to do with the quality of care, namely the quality of the education they are receiving. In order to combat this, the final assessment project for this site should address these educational issues.
In considering the community awareness of the problem, both patients and staff alike have mentioned a need for stronger clinical management related to chronic diseases. We believe that the community is ready to tackle the problem with the appropriate support from the staff. One strength of the community is patient appointment adherence, so we must be effective during that time to influence disease management. Chronic diseases such as obesity, hypertension, and diabetes are all manageable with appropriate education, lifestyle changes, and provider support. Encouraging patients to eat a well-balanced diet, get daily exercise, and maintain healthy habits are all essential for the patient to live a healthier life. Resolving this issue requires extensive education both in a primary and secondary setting through registered nurses and nurse practitioners providing education to prevent these conditions before they manifest into something more serious. As a timeline for this project, implementation can be immediate and exist as a continuing routine to improve patient education and outcomes at the practice long term.
In conclusion, we have identified that the population at Penn Internal Medicine and Penn Family Care has a knowledge deficit related to disease management and prevention. Based on interviews with staff and the histories of the patients we observed, obesity, hypertension, and diabetes were recurring health problems faced by our community. The windshield survey also helped establish our understanding of the reasons these health problems are going unmanaged. Lack of proper medication adherence, lack of education, time constraints for the provider, low socioeconomic status, and poor lifestyle habits of the patients are reasons why these problems exist. We have identified that some sort of education initiative would be most beneficial for our community project.
From interviewing the patients and staff, we believe that low-tech, portable, and easy-to-read materials are things that patients would appreciate. Pamphlets can fulfill these needs. Although obesity, hypertension, and diabetes have comprehensive information, we believe that pamphlets should at least include these key pieces of information: diagnoses for each condition, background information about causes, risk factors, and symptoms, interventions such as medication for the conditions, a section on healthy dieting and lifestyle changes, and self-management techniques including glucose checks, monitoring blood pressure, and keeping food diaries, which would all be important for these patients to have.